So in these patients who have accidental encounters, severe reactions, and going into the impact of food allergies, I've personally seen extreme anxiety in some patients. What have you three seen in terms of the psychological, social, or quality of life impacts of food allergies, particularly in those with undertreated or undiagnosed food allergies?
It's tremendous. I think everybody's nodding on the panel. It's the key to all of this. The parents, for sure, are extremely concerned, especially in the very, very young who are maybe not as verbal yet, in accidental exposures and what symptoms they're going through. And it's just, they don't have them under their watchful eye for 24 hours a day. It's just always on their mind. And going to a special event or a social event, what's going to be in the food, even though you ask them to avoid this, it doesn't always get translated, and people are not necessarily careful, who don't really understand food allergies. So there's just a lot of angst and anxiety that they constantly carry with their children. And then as they proceed to school, now they're out of their careful, watchful eye. That adds now another layer of concern for them. And how serious will be taken at school, despite having all the plans and written forms out. Things sometimes fall through the cracks, I think, for them. So clearly it's on everybody's mind, and the children themselves, they sort of pick up on this. They know it's serious. Then they get very, very sort of concerned, and I think withdrawn to some degree, because they're constantly asking and not being able to participate in all the events that maybe they're invited to, birthdays and so forth. So I think all around, it's a very traumatic and psychologically stressing event for them.
Yeah, that's very rightly said. I've, in my practice and clinical experience, noticed a lot of anxiety, and there is also, when you can't deny that food is usually a central part of any given social interaction, So sometimes patients also face certain social isolation and apart from that, there is definitely a severe sense of stress, and even maybe it wouldn't be wrong to say maybe even depression in some cases. So I think there is definitely a lot of impact on the quality of life, and this sense of there are patients that go through embarrassment and a lot of self-consciousness. So a lot of sensitivity is required while treating these patients, I feel, and I have a lot of extra empathy when it comes to the mental aspect of discussing people with food allergies.
Yeah, 100% agree. And I like how we touched on cultural sensitivity too a bit. So living here on the Gulf Coast, where gumbo and crawfish boils and all those things are really part of your cultural identity. A lot of these kids who have like seafood allergies, I was one of them growing up, you miss out on a lot of activities with your family and friends. And so sometimes it's also talking to families and their peers on how to make them feel welcome within these circles without putting them at risk. And that's one that actually comes up a good bit when you have like the seafoods, the pecans, like all those things that you find rich within cultural identities, but maybe we're not able to really participate in that for some people.
And this is both to the group and Dr. Tawila, but Xolair was approved earlier this year, and I've gotten multiple of my patients started on it, specifically in the cases where they have terrible anxiety, going off to college, or having two chefs for some reason. How have you seen proper treatment improve or reduce these impacts in patients' lives?
This is something that we've talked about with patients for a while, saying that there's something coming down the pike. And we knew this was going to happen a while ago. And of course, every conversation is, have you heard any more about the shot? They kept referring to. And I now can actually say, yes, now it's been formally approved. And we had this long list of patients who have been waiting for this sort of thing to come along, because I think this is going to be a real game changer. The whole biologic wave in all specialties across medicine is really the wave of the future, and this immune impact is going to really make a splash. And this is a very good example of that with Xolair. I think it definitely gives us a way to really try to impact this reactivity and the potential for anaphylaxis, and again raise the bar and threshold for inadvertent exposures up to a point. And that's just a margin of error that they're looking for to give them that comfort and lessen anxiety and maybe really get some normalcy back into their lives. And that helps everybody, the parents, the caregivers, et cetera. So it's been welcomed with very, very large arms and great big smiles. The question now sometimes has to do with the practicality and the frequency of the injections, and of course the coverage. This is a very expensive product, as I think everyone knows, and there is that logistic part that you have to sort of jump through, but we're very excited, and I think there's others coming down the pike besides Xolair at this point.
Great. So yeah, I can also comment on the pipeline products. Some of the products are specifically targeting the inflammatory cells in addition to multiple food OIT, which is exciting for everyone.